I'm Dr. May Teo. I'm an oncologist in Surrey. I treat breast and brain cancers, and I also work with the Surrey and Sussex Cancer Alliance on personalised care and support for oncology patients. Cancer treatments are very varied. Patients can receive drug therapies. That could be, for example, chemotherapy or targeted therapies. Patients can also receive radiotherapy. And the side effects from these treatments can be very different, very variable. And also how it affects different patients or different individuals can be very variable as well. It's really important for patients to keep in close contact with their healthcare team throughout their treatments to let them know if they are developing any side effects, if they're unsure whether the symptoms they're experiencing are related to the treatment, because early intervention for side effects is much more effective than if things become too bad and then it becomes more difficult to manage. So we always encourage patients to speak to their specialist nurses, their oncologists, treatment helpline to report their symptoms. One related top tip would be to perhaps think about keeping a diary of your symptoms. For instance, if you're having 3 weekly chemotherapy, it might not be very easy to remember how you felt at the beginning of the cycle. So by writing it down, you can bring that along to your consultation with your oncologist to discuss the symptoms you've been experiencing. The use of supportive medications or interventions to help with the side effects will make things easier for patients. Using chemotherapy as an example, often there are medications that are prescribed to help with some of the side effects. For instance, nausea and vomiting. Patients are prescribed anti-sickness medications. We would encourage patients to be proactive with taking these medications because, again, it's better to try and minimize or even prevent the side effects rather than wait until they get too bad. Some of these treatments do affect your appetite. Some treatments can cause things like a sore mouth, or it can change your taste buds. Try and keep a balanced diet as much as you can. There will be things that you don't necessarily feel like eating during treatment, but as long as you're eating little and often and trying to keep your nutrition and your calorie intake up, that would be the main thing. And keeping well hydrated during the treatment is important as well. Some treatments can cause later effects. For instance, radiotherapy to the abdomen or pelvic region, that can cause longer-term bladder or bowel symptoms. It's important, again, to just keep in touch with your healthcare team, your specialist nurses, if you are developing side effects even after the treatment is finished. The fatigue that you can experience following cancer treatments can also last for quite a long time. That isn't unusual. So I think it's important to be kind to yourself and to give your body the time to recover after the cancer treatments. It's helpful for patients to try and keep to a routine if they can during treatment. For instance, building in a regular time to have a short period of physical activity that can help to combat cancer treatment-related fatigue. Of course, there will be days when you may feel too tired to do so, and it's important to listen to your body. If your body's telling you to rest, then you need to rest. But keeping to a routine, I think, can help with also the sort of the psychological aspects of coping with cancer treatment. And I think the other important thing is sleep. Keeping to a sleep routine is important to enable you to get enough rest, to allow your body to recover, and again, helpful for managing fatigue as a result of treatment. Going through treatment is difficult and it can be very challenging. And I think we've talked a bit about the physical aspects of side effects and the importance of speaking to the healthcare professional team to highlight these side effects early so they can be treated and managed appropriately. I think the other important thing is the psychological aspect. Your emotions will be up and down as you go through treatment, and I think it's helpful to talk about your feelings and talk about whether you're struggling with your treatment psychologically with your clinical teams, with your specialist nurses. That is what they're there for, really.